My mom was the biggest inspiration in my life. She was my rock, my reference to everything I did in my life. So yeah, she was a big part of my life. But in 2007, she got diagnosed with breast cancer. It was a painful experience for the whole family. After that, my two aunts got inspired to get checked, and they get diagnosed as well. The three women that were playing a big part of my life were diagnosed with breast cancer all at once. Thanks to my mom, my aunts are still here and they're healthy, but my mom passed away in 2014. So I was 35 at the time, and I thought I should get checked for my risk of breast cancer. Insurance told me I was too young to get a mammogram, so I had to advocate for myself, and I had to get the mammogram done. So about 2 months later, I did. The mammogram came back abnormal, so I had a biopsy. A few days later, they called me back. I remember exactly where I was. I remember everything, and I pretty much dropped the phone. I had DCIS, ductal carcinoma in situ. They told me it was early stages, but it was cancer. Next couple months after that, it's a little bit of a blur. They caught it early, so I didn't need chemotherapy or radiation, which was, good news in the bad news. I knew that I wanted a double mastectomy, so I brought it up to the breast surgeon, and she agreed. I was young. I was wondering what I would look like after a double mastectomy. One of the options she gave me was reconstruction, which is what I wanted.
When I had met Gaelle, she'd already met with her breast surgeon and her surgical oncology team. My job was to really make sure that we were going to be able to achieve the aesthetic results that she wanted. I asked her to show me examples of what she considered her desired goals. That allows me to take my technical skills and mesh the two together to create the outcomes that she wants.
I thought to myself, you might as well get bigger ones.
You're going to have a mastectomy. We're going to put an expander in, and that's going to allow us to start shaping the breast. There are various reconstructive options and various reconstructive pathways that we can choose, the patient and myself, in order to try and achieve their desired goals. The Natrelle Inspire line of implants is my top choice of implants. The multiple choices of size, profile, and cohesivity allows me to create customized reconstructive plans and options for each specific patient.
So I never done anything like this before, so I asked him about the risks, and he explained to me everything.
I find that patients take comfort once they're educated, once they know the specifics about what lies ahead, then the journey becomes more manageable. So I make sure that all of my patients leave with a binder that contains all of the important safety information and a patient decision checklist. It's important that they understand that breast implants are not lifetime devices. The longer that a patient has implants in, there's a greater chance that they will either develop complications or that they may require more surgery to deal with those implants. Breast implants have also been associated with a cancer of the immune system, and some patients have died from that cancer. Patients have also reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others.
After reviewing all the information and getting all my answers from Dr. A, I was ready and confident to move forward.
In Gaelle's case, we used a stepwise approach to her reconstruction, which starts with the mastectomy and the expander in order to create a pocket for the implant. At a second stage, we exchanged that expander for a permanent implant. And in Gaelle's case, I recommended fat transfer at a later stage in order to achieve those desired aesthetic outcomes.
I couldn't do anything difficult or strenuous 2 weeks after surgery, but I had my family and my husband to take care of me. The second surgery, they put in the implants, and the third completed the look, and I loved the results. Once my doctor cleared me, I was able to go back to working out a few weeks after, and get back, to my life.
It's extremely gratifying for me because I could see that she had a look that she desired. She was able to really move on with her life.
I travel a lot. We go to the beach, we hang out with friends. People have no idea that I had a double mastectomy and reconstruction. They just think that I had an augmentation, so I just share my story if I want to. I feel like I've been through a lot, but I also feel confident and I'm very happy with the results. As I look back, I know that my mom was behind me. Wherever she is right now, I know that she's proud of me. She'd be proud of how I advocated for myself and how I'm alive today.
My message to women out there who are choosing breast reconstruction or who have had a mastectomy is that there are so many reconstructive options available. So talk to your surgeon. We're there for you to help select an option and a choice that's right for you.
And do regular self-breast exam. Don't miss your checkup. And if you have a history of breast cancer like I did, go to your doctor, talk to your doctor, make sure you get a mammogram. This is what saved me. So it's very important.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. Autoimmune diseases, for example, lupus and scleroderma. A weakened immune system, for example, taking medications to decrease the body's immune response. Planned chemotherapy or radiation therapy following breast implant placement. Conditions or medications that interfere with wound healing and blood clotting. Reduced blood supply to breast tissue. Clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with a diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening, and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition nipple complications, hypertrophic scarring, and implant palpability, visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.